Today we are gonna talking about genetic counseling. It first we are going through our genetic counseling to know about the term what is genetics and inheritance and counseling mean. It will be helpful to understand the topic genetic counseling. So the term genetic is a branch of science in which we study about gene and their pattern of inheritance of a particular disease or trait from one generation and to a next generation. And what does inheritance mean? Inheritance is a passing of a trait from one generation to a next generation. You can say it a way of passing of a trait from one generation to a next generation. Like we see in our daily life, like hair color, some people have like tallness, their height, or eye colors. They are matching their family members, like their parents, grandmother, grandfathers, like that. So these traits are actually passed from one generation to a next generation. So in inheritance term, we see about their process of passing of these disease from like traits from one generation to a next generation. And what does counseling mean? You can say it a talk therapy between a trained professional and a person or a couple who are seeking for their solution. They are they are facing any problem like genetic problem in their family chromosomal abnormalities. So now move toward our topic. What is genetic counseling? Genetic counseling is a way for people to understand how genetic illness can affect them and their family. Genetic illness is also called a genetic disorder that is caused by a gene, like change in gene, we can say is a mutation. Mutation may be accidental, either due to a error or mistake in a DNA replication or change our DNA sequence, or by environmental factors that may cause mutation like radiations, chemicals, and infections agent. They may be harmful and they can cause mutation in a gene or alter the sequence of our DNA. It may be like in some cases like deletion or addition of a chromosome, translocation, invariant. Sometimes it is helpful like in evolutionary perspective, origin of a new species, but in sometimes it may be harmful in case of chromosomal abnormalities. So, in genetic counseling, we see about their chromosomal abnormalities, their pattern of inheritance. Sheldon Reed proposed the technology genetic counseling in 1847. And the next question is why someone see a genetic counselor? Why they need to see a genetic counselor? What is the indication people who go to genetic counselor visit a genetic counselor? People might see a genetic counselor for many reasons. For example, someone with a higher risk of having a child with a genetic illness might get genetic counseling. People who already have a child with a genetic illness, so they go to a genetic counselor before conceiving a next baby. A woman who have a two or more miscarriages, she she delivered a stillborn baby that had a physical signs of a genetic disorders, so they go visit a genetic counselor. And some people want to know if they are carrying a gene of illness, like in some families any genetic disorder is running, so they want to know they are carrier or not, they have a chances of affect their next generation or not. So people want to know they are carrier and also they visit a genetic counselor. And in maternal age also effect, like a maternal age is 35-year-old, she has a chances to face complications in her pregnancy, so they visit a genetic counselor. For example, she likely to develop a gestational diabetes. This type of diabetes occur during a pregnancy. If it left untreated, it affect the growth of a baby or it cause increase the premature birth chances. And she likely to have a high blood pressure during pregnancy that may cause you a preeclampsia. And preeclampsia damage the organ system like liver, kidney. It may be life threatening for both mother and a baby. Family history of mental retardation, early onset of a cancer in our family, a mother who is affected with diabetes, epilepsy. So these are the some indications why people need a visit to a genetic counselor. And the next is question that come in our mind is what happened in genetic counseling. Yeah, we studied about what is genetic counseling, why people need genetic counseling though. So the next question is what happened actually in genetic counseling. So in genetic counseling is you can say it is a meeting with a genetic counselor and a consultant. They ask questions like about their medical history, like such as an illness that is running in their family, woman who had miscarriages, stillborn babies, or unexpected death of their child. They look at medical records. Counselor recommends some genetic tests. They look at the result of the test and explain how genetic changes can cause genetic illness and how likely they affect their family in upcoming generation, and what should they do next. A genetic counselor provide a support while people decide what is right for them. They don't interfere in their decision, but they help them to make a decision about their reproduction. Genetic counselor will also ask the question about their pregnancy history, like if a woman had any medications or any kind of exposure of a harmful substance from environment like chemicals or radiation or now the is aims of genetic counseling. The main aim is to provide a family with a complete and accurate information about genetic disorder. Like in case of cancer, most of the cancers are not inherited, but some have dominant genes that cause disease. After genetic counselor, they able to tell them the cancer that is running in their family is related to a dominant inherited gene or not. They can take appropriate course of action, how genetic disorders can affect them or their family, and how to avoid it. Guide treatment plan for some type of illness, like they see if a medication will work better or not, or they need any kind of therapy. Explain alternatives to reduce the risk of genetic disorders if medicine not works, so they do a gene therapy. Reduce the impact of disorders, allow people who are affected by inherited disease to make informed choice about future. Provide early knowledge about disease to reduce the risk of getting a treatment, like a newborn screening test. It is very common in USA, United States. The actually in this test, certain genetic, metabolic, or abnormalities they tested. This type of genetic test is important because if results show any disorders such as chromosomal abnormalities, sickle cell anemia, like that, their treatment start begin right away. So now move toward the steps of genetic counseling: history, pedigree charting, transmitting information, and management. History: proper record of a family and a patient. This include both past and present. Family history also includes siblings and other relatives. It is important to note that if any other member of the family is suffering from a similar disease, this also include a obstetric history like exposure of teratogens like drugs and X-rays. This inquiry should be also made about the consanguinity, whether a couple is blood related or not, because it increase the chances of children affected with a condition like autosomal recessive disease abnormalities like that cystic fibrosis and sickle cell anemia. Cystic fibrosis is an inherited disease that damages the lungs and digestive system and other organs. You can say it damage the respiratory system and the digestive system. And in case of sickle cell anemia, it blocks the blood flow toward the organ. In the blood oxygen is low because the blood is blocked. It affects the kidney, liver, and spleen. It may be life threatening or it may cause blindness. History also include the person's ethnicity. There are some ethnic groups that have a higher risk of having genetic abnormalities, like American African is a carrier of sickle cell anemia. So it is important to note down this kind of information. So the next step is pedigree charting. Genetic counselor construct a pedigree chart after a complete interrogation. Pedigree, a family tree which show the parents and offspring occurrence and generation, as well as who possess the particular trait. Pedigree of individual family are used by genetic counselor to aid them providing information to their family. Actually, pedigree charting is a most important aspect of genetic counseling. To see mode of inheritance analysis, family tree, they could recommend some genetic test, and then they look at the result of the test to see how much chance of disease occurrence. Actually, genetic counseling help you and your family to make informed decision about genetic testing. Genetic testing look the change in your DNA. Actually, you can say that genetic counseling reveals the chain mutation, your gene that may cause illness. Genetic tests provide important information about diagnosis, treatment, and prevention of illness. In case of pharmacogenetics, genetic tests may help to determine what medication and dosage will be most effective and beneficial for you. Actually, it is important to note down the which kind of genetic disorder you are suffering from and which kind of medication you should take, like any kind of medicine which will be effective for you, or any kind of gene therapy like stem cells transplantation, like that. So it is important to get to know about the what kind of genetic disorder you are suffering. The next is method of sample taking. Actually, it depends upon the which kind of test you are going to be collected. There are few types of blood sample taking, like blood sampling, cheek swab, amniocentesis, and chronic villus. So let's see. It is not a difficult like actually people say blood sample. Healthcare team takes sample from blood by inserting needle into the vein of your arm. And in case of a newborn screening test, blood sample is taken by pricking your baby heel. Actually, in case of an adult, they directly insert a needle in their arm to take blood. Like, but in case of a newborn, they are not strong enough. They have not that much strong to bear that kind of test. So they pricking. In a case of newborn, they are not that much enough. So they take a blood sample by pricking baby heel. Cheek swab, the swab sample from inside of your cheek is collected for genetic test. And amniocentesis, they collect amniotic fluid from testing. And in case of chronic villus sampling, they take tissue from placenta. So the last is management. In this step, we see if there is any treatment regarding their condition. In management, strategies are designed to improve the patient signs and symptoms to improve their health, or it depends upon the individual health needs. Like some people have a weak immunity and some have a strong immunity, and approaches are also vary by disorder to disorder, like how what kind of disorder they are suffering from. And some of the genetic disorders are curable and most of the disorders are not curable. Like in case of Huntington disease, it is a brain disorder, and cystic fibrosis, these are uncurable diseases, but some are a curable disease like thalassemia and sickle cell anemia. They are treated with a bone marrow or blood cell transplantation. Treatment are actually to minimize the damage by early detection. There is a not proper cure of the genetic disorders. So here is the end of our topic. I hope you like it.